Okay, so now with the second molar, we're going to do it, it's very similar to the first molar. Make the dots, get it set on there, lute it down, and then you want to look and make sure, again, that the cusp tips are lined up in a nice straight line, central groove, and the buccal cusps. You might have some, just because of the shape of the teeth, see these aren't perfectly straight, they're kind of tapered. You might see some natural curvature here on the buccal side, which is normal. That's just the way the teeth are. So, but the important part is getting this, basically the central groove straight and these cusp tips lined up. And you want to make sure that when you look at it from the side, you want to see a nice, even curve of spee. It's supposed to follow basically this curvature. So your curve of spee here should follow this nice gentle curve of the mandibular arch. Now also, along with the first molar and the second molar, you want to check and make sure that your cusp tips are on this line. And as you get further toward the back, towards the second molar, it gets a lot harder to see because this thing gets in the way, and you just kind of can't see. So what I do is, and the whole point of it is, you take this off, and you want to make sure that, because the whole reason we draw this line is to make sure that we're on ridge here. So another thing you can do is basically take that off and just check and make sure that these teeth are on line with this ridge. Now for this particular ridge, because it's curved, it's not going to be exactly right on the way we drew our line. It's just slightly lingual, but especially for this side, you want to make sure that these teeth are kind of right on ridge. That's one of the things that they check for actually when they're grading. They'll take the mandibular teeth off and they'll kind of look and see, hey, you know, how on ridge is this person by looking at these cusps here in relation to this ridge. Okay, and remember normally that we would set both teeth. I'd set both premolars, both first premolars once, get them in the right position, then the seconds, then the first molars, and the second molars. So before we move on to the mandibular, we're going to go ahead and set all these and get ready to go. One of the things you also want to do is check and look and make sure you have a nice even flow. It looks kind of weird when the wax is messy. It may not look right, but once you festoon and everything, it should look, you know, a lot better. But you just want to correct any gross things. Things should just be even. You don't notice anything jumping out as you're going back. The teeth are kind of nicely, you know, you see about an even amount of change as you go from anterior to posterior. So that's that. Now we'll set the other side, and then we'll move on to the mandibular.